HICPAC, November 2nd. This was a full 8-hour day meeting. Right out of the gate, we had a surprise. They announced that they were not going to be voting on specific pathogen guidelines, so that would include COVID, but that the November 2nd and 3rd meeting would only focus on a healthcare setting, isolation precautions, and PPE use. Where that if what was voted on was approved, spoiler, they were, then once the CDC signs it off, Medicone signs it off, then it would go to a 60-day final public comment after the CDC proposes the guidelines so that we can complain one last time. The meeting started off slow after that, where we focused on things like hand hygiene and including chlorohexidine rather than simply saying soap for hand hygiene. There were discussions about masking and enhanced barrier face coverages, which wanted to be added in for the wording because this is still being approved. It is not yet approved for medical use, which to me is weird. Why would you add something in that's not approved yet? And they threw in a line about specialized air handling, and it was very weakly worded. Basically, all it talked about was portable HEPA filters and ultraviolet germicidal radiation, and they didn't set standards or be like, yeah, you need to have a HEPA filter in every single patient room, and they need to be changed at this frequency. You need to have this type of HVAC system, things like that. They didn't do anything. They just have this very vaguely written line. That's all they had. In the transmission based protocols, they completely ignored asymptomatic presentations of diseases or history of exposure, where just gowns and gloves were recommended for things like skilled nursing facilities, and this would involve things like central venous catheters. So they didn't have a mask recommendation for that. And I would think that if you're dealing with something like a indwelling catheter, you would want to make sure that you're wearing a mask so you don't infect the patient in that. And this also would include things like tracheotomies. So there was a clear weakening in that area. And then they designated things such as special air precautions and extended air precautions, where special air precautions would be PPE, but no room component, and extended air precautions would be airborne infection isolation room. So this would involve an N95 respirator with or without eye protection by the healthcare professional. And the designation between these two things would be decided by the facility itself. There would not be a risk assessment to level matching that would occur. And then at this point in the meeting, they announced that specific pathogen disease recommendations won't be updated for 2 to 3 years. So they will continue off of the 2007 recommendations that will be updated slowly on a pathogen by pathogen basis, which to me doesn't scream transparency in this whole process because they could just hold a closed door meeting, make some adjustments. Oh, we're just making minor modifications to the document for a pathogen like COVID. And then they make the modifications, and we don't have our due process where we can publicly comment and provide feedback and etc. So that was something that really pissed me off. That was essentially the overview of the 8 hours. And then we rolled into the speaker comments, and I want to go through and highlight a bunch of these that I thought were really well said. Mary Jimenez Saba, as part of the People's CDC, demanded to delay the vote and to incorporate the comments provided by the People's CDC, and that N95 respirators should be standard. We need ventilation and core isolation control protocols with universal masking year round. And then there was Rosalie Bright, who is a federal epidemiologist, who noted that we did not have access to the draft until that day's meeting, that respirators should be used as a standard precaution all the time. We need universal precautions, masks for all, increased ventilation, increased clean air with filters and filtration and UVC. That HICPAC's perceived infectiousness is inadequate, that we need to presume that everybody is infectious. Rosalie also objects to allowing healthcare workers to forego wearing masks for mental health concerns. Preventing infections should be the main concern, that we need frequent testing and monitoring for COVID among workers, patients, and visitors. and that if a healthcare worker uh, has a positive test, isolate at home on paid sick leave. Maria Giffen Castro avoided medical care because of risk of getting COVID. They have long COVID, and they want clean air and high quality masks in healthcare settings. And that when they try to call ahead of time to healthcare settings to ask them to wear masks, they refuse and say that they're only following the CDC's guidelines. And they even noted that no vaccination sites currently require masking during appointments. Then there was Zanel Triunfa, part of the National Nurses United, asking to delay the vote, stating that HICPAC has not given public opportunity for the public to review the draft before the meeting, so it's still missing essential perspectives from people such as frontline workers, experts like industrial hygienists, respiratory protection specialists, ventilation specialists, and that we need ventilation, PPE, respiratory protection specifically, contact tracing, testing, exposure notifications, and to hold public meetings for public comment and public input. Eric Berg from the Cal OSHA program had some great remarks, but the most outstanding was the statement of the CDC recommendations are often used as de facto law by healthcare facilities. And if the CDC is releasing weaker guidelines than Cal OSHA actually puts out themselves, then there's confusion and the perceived authority by healthcare facilities to use less protective measures put out by the CDC as opposed to what is set at the state level because they think that that's the way to go. So they're using it as an excuse or a cop out. Danford or Ray Mills, I wasn't really sure what the name was, um, said that COVID needs proper classification with other micro aerosol viruses. Then we have Chloe Humbert. Healthcare workers refuse masking, say they're following CDC guidance, so we don't have to mask, but you can if you want to, is what they get in response to requests for healthcare workers to mask, where they believe that the CDC is focused on patient experience and not infection prevention, noting that several members of the committee wrote a think piece that was essentially an anti mask article, which amongst the scientific community has been thoroughly debunked and lambasted. Ultimately, people want masks in healthcare. Then there was Naomi Bar-Yem, part of the World Health Network, who states that policies set by the CDC guidelines are used across the world, underpinning that the pandemic is not over, that HICPAC does not have all the info and resources they need to set appropriate guidelines. They need occupational health practitioners, aerosol transmission, and even patients. They need to bring in other experts. Jaquan Beltran asked to require respiratory masks to improve ventilation and to bring back reporting of hospital infections, that masks should be the standard of care, and that while we were all masking and isolating at the beginning of the pandemic, Jaquan noted that one flu strain may have been completely eradicated due to masking during the pandemic. It's has not been seen since that happened. So by masking, we may have completely eradicated a strain of the flu. Megan Cunningham echoes that healthcare workers still refuse to mask despite written ADA requests, and that hand hygiene is not enough. And then there was Jay Hersmark, an industrial hygienist, who made a funny joke saying that it's like talking to a television. I can hear them, but they can't hear me in regards to HICPAC, pleading with the committee to talk to us so we can help reduce infection. So that's pretty much everything from uh, an 8 hour meeting distilled into less than 10 minutes. Next, I'll move over into day two, talk about the specifics of what was discussed, the guidelines and language that were set, and then what was ultimately approved, as well as the final comments by other people that came for that day.